Hi, everyone. Welcome to Sex and Science, the podcast where we explore how biology shapes the way our bodies develop and respond to disease. Today's episode is titled Sex and Gender Differences in Medicine, Why Treatment Isn't One Size Fits All. My name is Maina, and I'm joined today by my co-hosts Jenny, Mia, and Isham. Did you know that the same medication can affect men and women differently, even when they have the same condition and take the same dose? These differences often come down to hormones and biological sex, which influence how our bodies develop, function, and respond to disease.
In this episode, we'll explore how sex-based hormones affect vulnerability to certain medical conditions. We'll also discuss how treatments and medications may work differently depending on sex, and why researchers are increasingly focusing on personalized medicine to improve health outcomes for everyone.
By understanding the role of hormones in health and disease, we can better appreciate why one-size-fits-all medicine doesn't always work, and why considering biological differences is an important step towards safer and more effective healthcare.
We're going to start off by understanding the role of hormones on health. A 2018 study describes the role sex hormones play in endocrine disease. Although males and females have the same circulating hormones, they vary in concentration, production, and interactions with other body systems. This results in differences in the likelihood of developing certain diseases between men and women. Most of these sex-related diseases are addressed in the article, including thyroid disease, diabetes, osteoporosis, and many more.
Yeah, I've read some case studies about these, and we will get into detail later on.
On that note, one significant trend I noticed was the higher rates of autoimmune disorders among women. In fact, women have a 4 times higher risk of developing an autoimmune disease.
Oh wow, 4 times?
Yeah, I found that shocking too. I looked into this more and I found a hypothesis that describes this issue. The pregnancy compensation hypothesis states that females have immune systems that are evolved to be stronger and more reactive over time, and this is due to pregnancy. So during pregnancy, a fetus is perceived as a foreign threat to the mother. And because of this, the fetus constantly downregulates or represses the mother's immune system. In order to compensate, women have evolved to have a higher functioning immune system despite not being pregnant. This can lead to overactivation of the immune system where the body mistakenly attacks itself, and that results in an autoimmune disease.
Yeah. One specific example of an autoimmune disease that varies between males and females is systemic lupus erythematosus, or SLE.
I don't know much about lupus, so how does it differ between men and women?
A 2012 study states that this disease presents most in females of childbearing age, and in this age range, the ratio of females to males with this disease is 9-1.
So why is that? Could it be due to a hormonal difference?
Definitely. Studies have shown that in mice with SLE, adding additional estrogen worsens the disease, while adding additional testosterone improves the condition.
Whoa. So how can those sex hormones make such a big difference?
So estrogen affects the body through 2 main receptors, estrogen receptor alpha and estrogen receptor beta. These receptors are expressed in lots of different places throughout the body, including most immune cells, meaning estrogen can affect both innate and adaptive immune function. Estrogen has been shown to stimulate certain B cells, which produce autoantibodies, present autoantigens, and secrete pro-inflammatory cytokines, basically leading to a greater autoimmune response. In fact, rodent tests have shown that if you knock out estrogen receptor alpha, rodents with SLE have decreased disease severity and prolonged survival.
Wait, but estrogen is present in males and females, so why does it affect them unequally?
You're definitely right, but estrogen is primarily produced by the ovaries in females, while males typically lack ovaries, so they produce less estrogen. The effect of ovaries on SLE is displayed in rodent tests, which show female mice with removed ovaries have delayed disease onset.
Wow, so it seems like estrogen plays a key role in lupus, but that doesn't really seem fair. It seems like people with ovaries just get the short end of the stick.
Well, that may be true in terms of disease frequency, but males actually have some worse outcomes associated with SLE. In fact, one condition associated with lupus is lupus nephritis, in which the autoantibodies produced due to lupus attack the kidney tissue, which can lead to high blood pressure and kidney failure. And strangely, this condition is more frequent and causes more severe damage in males.
Whoa, so why could that be?
This might also have a hormonal basis. Like before, male or female castration leads to changes in renal disease, suggesting that disease progression is affected by hormones. In fact, several studies have shown that estrogen and testosterone interact with the renin-angiotensin system. This system regulates blood pressure, meaning if it is overactive, it can lead to high blood pressure.
Okay, wait, what do hormones have to do with this?
Right. So estrogen actually reduces activity in the system while also upregulating protective pathways which oppose vasoconstriction. Male hormones kind of do the opposite, and the same studies have shown that testosterone actually stimulates this pathway and encourages vasoconstriction.
Well, what does this mean for lupus?
So, males have a higher risk of high blood pressure due in part to testosterone's effects on the renin-angiotensin system, and high blood pressure is a leading cause of renal disease in general. Then, if males with SLE have lupus antibodies already attacking the kidneys, this can increase blood pressure even more, which can then damage the kidneys more, creating a dangerous cycle and potentially explaining why males with SLE have lupus nephritis more often and with more extensive damage. So, overall, this disease does not affect males and females in the same way. Females suffer from the disease more often, while males have greater disease severity when it comes to lupus nephritis and renal related injury, and it's very likely that this is due to differences in sex hormones between the two sexes.
Then I wonder, should treatment be the same for males and females?
I would imagine not, but I think Mia and Isham have some more information about how hormonal differences affect medication strategies.
Thanks, Jenny. When we talk about how hormones affect health, one of the most important areas to consider is how they influence medical treatment. Did you know that historically many medications were tested primarily on male participants, which meant doctors did not always have complete information about how those same drugs might work in females?
Wow, how does that compare to today?
Thankfully, researchers now recognize that biological sex is an important factor in treatment outcomes and medication safety based on research published in 2021. Hormones such as estrogen, progesterone, and testosterone can affect how the body absorbs, distributes, and breaks down medications. These processes can vary between males and females due to differences in hormone levels, body composition, and enzyme activity.
Okay, so things like hormonal fluctuations during puberty, pregnancy, or menopause can change how quickly medications are metabolized?
Right. Changes in hormones can also influence changes in the presentation of symptoms, which may require adjustments in dosage or treatment plans depending on what the individual is experiencing. For example, pregnancy can alter blood volume and kidney function, which may require adjustments in medication dosage to keep the parent and fetus safe. One review from 2023 found that sex differences play a significant role in how people respond to medications, including drugs used to treat cardiovascular conditions, pain, and mental health disorders.
Gotcha. So instead of assuming one treatment works the same for everyone, healthcare providers can tailor therapies based on biological differences, leading to better outcomes and fewer side effects for patients.
Exactly. Understanding how hormones and sex differences affect treatment helps move medicine toward a more personalized approach.
But medication responses are just one example. A research study from 2020 talks about how health and medical treatment are not experienced the same way by everyone. And a key reason for this is the influence of both sex and gender. These factors shape how diseases develop, how symptoms are recognized, and how patients interact with the healthcare system.
Right, but what's the big difference between biological sex and gender?
Great question. Biological sex is the classification of individuals based on physical traits like chromosomes, hormones, and gonads. Gender, on the other hand, refers to an individual's social roles, expectations, identity, and experiences.
So, what you're saying is that someone's sex assigned at birth and their gender identity can both play a role in impacting their health?
Exactly. For a long time, these differences were not consistently considered in research or clinical practices, which contributed to the gaps in how conditions were identified and managed. For example, heart attack symptoms in women and men can sometimes differ, with men often experiencing severe chest pains and women experiencing nausea, fatigue, and shortness of breath.
That's interesting and a little concerning. So, biological differences can actually change how diseases show up in the body?
Yes, factors such as hormones, genetics, and body composition all play a role in shaping these differences. Differences in muscle mass and body fat can also affect how medications are stored and released in the body.
So, biology clearly matters, but earlier you mentioned that gender can affect health too. How does that work?
Social and cultural expectations, along with access to resources, can influence health behaviors and outcomes. People may delay care due to stigma, cost, or pressure to seem tough. These factors also shape things like preventing care, mental health support, and reporting symptoms. Gender bias in healthcare can further affect how seriously symptoms are taken and the quality of care people receive.
This all shows how complex human health can be. With novel research, scientists are learning that sex, hormones, and gender are important in understanding disease and treatment. By recognizing these differences, healthcare providers can move toward more personalized medicine that is safer and more effective for everyone. Thank you for listening to Sex and Science. We hope this episode helped you better understand how sex differences influence medicine and why personalized care is becoming increasingly important in modern healthcare.